It's not news anymore that a lot of women do suffer from vaginal itch. Yes, itchiness of the vagina. And trust me, it is not because you do have a poor vaginal hygiene, neither because you are dirty. No, as little as overwashing of the vagina is, could lead to itchiness of the vagina. Yes, I want you to understand that the vagina is self-cleansing itself, and there's also a difference between the vagina and the vulva. I didn't say you should not wash your vulva. Wash your vulva, but don't wash your vagina. Yes, trust me, the outer part you are seeing is known as the vulva, while the inner part, the birth canal, that hole which you are seeing in between your legs, is known as the vagina. So guys, on today's topic, we're going to be talking about yeast infection, also known as thrush and also known as candidiasis, popularly called yeast infection. So today we're going to be talking about yeast infection generally. So let's go. Hey guys, so welcome back to my channel. It's your girl Nasmav. If you're a new subscriber here, you're welcome. Returning subscriber, you got a special place in my heart. I'm here because of you guys. So on today's topic, as I earlier mentioned, we're going to be talking about yeast infection, popularly known as yeast infection, also called thrush and also called candidiasis. Yes, it's no news anymore, like I said, that at least in 4 in 5 women do suffer from or have had yeast infection. Yes, and we are going to be concentrating on like the causes, the prevention, and also the treatment. So we're going to, as I said, we're going to be concentrating on the causes, the treatment, and prevention. I don't know, there are a lot of obstacles that don't want me to film this video today. As you can see, there are noise here and there, but nothing is stopping me from not filming this video today. I will film this video today. So let's go, guys. Yes, when you talk about yeast infection, see, relax, let me tell you. If you have, and in some cases, not everybody do have like the vaginal discharge, yes, but if you have ever like inserted your hands into your vagina and you see this is kind of like milkish. Firstly, we are going to be looking at how to know you have a yeast infection. First of all, you'll be complaining about inching down there in your vagina. Yes, it will be inching you. You feel so uncomfortable. When I mean inching, so severe that if you are sitting down, you even want to be rubbing your bum bum against the chair, or you find it so very, very uncomfortable because down there in your vagina, it inches you. And as you are trying to inch it, you are causing cracks around the walls of the vagina. See, in that your vulva area, it will cause cracks there. And when you try to urinate, it will be so painful. And that is called dysuria. Yes, that is painful urination when you are due to that cracks there. So when the urine now touches those cracks, because those cracks now are like injury there in the vagina. So when it touches those cracks now, yes, it's going to lead to painful urination called dysuria. And now, see, when you are trying to now have sexual intercourse, when the penis penetrates into the hole, trust me, it's going to be very, very, very painful. And that is what we call superficial dyspareunia. Yes, that is painful sexual intercourse. All these are caused because of this thrush infection, this yeast infection. Now, let me tell you a story. See, I want you to know that this yeast infection, these are the normal commensals of the vagina. Yes, I mean they are kind of like they live in the vagina. They are not harmful to you. They are not the only bacteria that live in the vagina. Just the way in the walls of the or in the guts of the stomach, there are bacteria that are commensals. They're the same way for the vagina. They are you have your bacteria your bacteria there, and also your yeast. These are the normal commensals of the vagina. Yes, they live in the vagina and they help us in one way or the other. Yes, and since it's not only like the yeast that is present there in the vagina, other bacteria are still present there in the vagina. I mean good bacteria. So yes, they tend to compete for space. Imagine in this room, we are like 1,000 persons in this room. We all are going to be competing for space. Do you understand? So in that process of trying to compete for space, it does not harm your body, it doesn't do anything to you. They are all just there living in the vagina. Now, get this thing right. Now, it now leads when this yeast infection now starts, when, for example, you as an individual, you took an antibiotic either to treat like a ear infection, chest infection, whichever way. And I want you to understand that antibiotics tend to kill both the good and the bad bacteria. That is why most of the time antibiotics are being sold under prescription. Yes, because we don't want you to over abuse these antibiotics. So when you take antibiotics either treat ear infection or chest infection, and along the line it kills these good bacteria in the vagina. Now imagine if we were about 1,000 persons in this room and about 500 persons dies, there is no space. So since there is not enough space now for this yeast infection, I now have chance to like move freely, procreate and multiply. I didn't mean that yeast infection procreate, but I'm just trying to create an illustration for a more understanding. Yes. So you now have space to like multiply, increase itself and all. And as that, it's instead of like, it does have, we like to, if you're supposed to be like a particular amount that's supposed to be in the vagina, but because of these good bacteria that were killed, so the yeast infection now have enough space now to like increase itself in the vagina. So it's now more than what the vagina needs. And as that is going to cause you this yeast infection, also known as thrush infection or candidiasis. Yes. So as a result of that now, you are going to be experiencing this itching, this uneasiness you are going to be feeling. And trust me, it can be treated. Yes. I want you to also understand that at least in every 5 women at some point is going to suffer from thrush infection or yeast infection. Yes, that does not mean that the individual got it from maybe sexually transmitted infection or is a urinary tract infection. No, just as I said, I hope with my illustration you are able to understand what I said could be one of the causes of this yeast infection. Yes. So another causes of this yeast infection could be as a result of you as an individual now overdosing of the vagina, inserting your fingers inside the vagina. So I want you to know that that hole is your vagina. Your vagina is different from your vagina is different from your vulva. Yes. See, the vulva is made up of like the labia majora, labia minora, the prepuce, the clitoris, and so. But you see that hole in which the penis penetrates, that is called the vagina. So when you insert your hands there, maybe trying to maybe pleasure yourself or anything, that can cause yeast infection also, because you are now introducing a bacteria. Like imagine getting like a bad bacteria coming to join the good bacteria there. You are also making your causing this yeast infection. Another cause of this yeast infection known as thrush infection is anything at all that disrupts the pH of the vagina. See, the pH of the vagina ranges from, I think, 3.8 to about 5.0, which is moderately acidic. Now, anything at all that disrupts the pH of this vagina can lead to yeast infection, also known as thrush. Then, what are the things, for example, that can disrupt the pH of this vagina is, for example, hot sit bath, like putting hot water in the bucket and sitting on it. Are you cooking your vagina? That can disrupt the normal pH of the vagina, making it or prone to this yeast infection also. And another thing again that can cause it is using things like scented wipes. They will say it's feminine wash that has fragrances. See, any feminine wash that has fragrances, please don't use it in washing your vagina. I'm cool with you washing your vulva, but please, when it comes to like scented wipes, scented soaps, medicated wipes used in wiping your vagina, is going to increase your chances of having a yeast infection. Yes. So, and another thing again that tends to increase or causes yeast infection again is an increased level of estrogen. Yes. See, estrogen is a female hormone. Now, for every pregnant woman, if you notice that most pregnant women will tell you, oh, my vagina is itching me, doctor, I'm suffering from vaginal infection, my vagina is always itching me, it's always itching me. See, I want you to understand that there is an increased level of estrogen when a woman is pregnant, and as such, it's going to make her prone or increase her chances of having a yeast infection. Yes, and for those who are pregnant, please, I don't advise you to take any oral antibiotics at all that in the treatment of treating yeast infection. And another causes, again, in terms of this increase in estrogen level, occurs between like this puberty period to menopause. So that's the from puberty to menopause. You see, in between that surge there's also an increase in estrogen, which could also make you prone to yeast infection, also known as candidiasis. Yes. So if we have talked about antibiotics, we have talked about touching of the vagina, hot seat, and introducing maybe using a medicated soap in washing your vagina, and a whole lot of other things that can cause yeast infection. We're going to be looking at how to treat this yeast infection. Now, in the it's also, sorry, before I forget, it's important to know that this yeast infection or candidiasis is a normal commencer in the vagina. So it's just naturally there. See, there are some persons that, will I say, monthly, maybe every three months, they tend to go for high vaginal swab. Now, it's not because they are experiencing any of these symptoms I mentioned about. They just go for this high vaginal swab, whereby they use like it's used like a stick sort of to swab your vagina, and it could take culture it, and it could take like about 3 days for the result to be out. See, it's important to know that yes, if your test result shows that candidiasis and you are not experiencing any of these symptoms, please, there is no need of you treating it, because candidiasis itself is a normal commencer of the vagina. Just as I said, yes, like it lives in the vagina, is a normal commencer of the vagina. And it's important to know that this yeast infection is an antifungal infection. It is not an antibacterial infection. It is an antifungal infection. It is with the help of the bacteria that are normal commensers of the vagina, and the yeast, they help more like in counterbalance it. So both of them can both be in the vagina and without disrupting anything. So it's when you take those your antibiotics now that tend to, like, antibiotics generally, because maybe you are trying to treat your ear infection. So this your antibiotics now is cannot just focus on only on the ear. It's going to more like killing the bacteria all over the body, and as that, it's going to kill some of the bacteria in the vagina, which will now give rise for this yeast infection to, oh, I'm now free, you understand, leading to this your yeast infection. So back to the treatment of yeast infection. So in treating of this your yeast infection, you can use stuff like vaginal creams, vaginal pastries, and antibiotics also. Yes. Now, when it comes to antibiotics, please, I will advise that you see a doctor, run a test to know which of the antibiotics will be good in the treatment of this your yeast infection. Don't self-medicate. I don't encourage self-medication. That's for antibiotics. That's like your oral antibiotics. Now, when it comes to vaginal pastries, vaginal pastries are like, you see those ones, for example, if you go to the pharmacy and they give you and they tell you to insert into your vagina. Yes, that is vaginal pastries. Then when it comes to like vaginal creams, it's more like in the tube. Yes, but it's indicated for the vagina, for whichever infection you are treating. If you are treating this your yeast infection, so you are going to like take and like maybe apply deep into the vagina, or you are applying like on your vulva area, then inside the vagina. Sorry about that noise. So that are some of like the 3 ways on which you can treat your vaginal your yeast infection, also known as candidiasis or yeast infection, just as I earlier mentioned. So we'll talk about using vaginal creams, talking about vaginal pastries, and we're also talking about oral antibiotics. So trust me, I said not all the individuals, not every person needs to take antibiotics or use vaginal pastries to treat their candidiasis. Some of them will just because it's a normal commencer. So when you go for test, it's going to show that, oh, you have candidiasis, which means that yes, because it's a normal commencer, so it's bound to like appear in your thirst result. We're going to be talking about how to now prevent this yeast infection. Yes, how to prevent your chances of having yeast infection. Please, as I earlier mentioned, avoid using stuff like medicated soap in washing your vagina, or will I say medicated wipes. There are some wipers with fragrances, medicated wipes. Just avoid using that around your vagina area. Then it's also important to know that when washing your vagina, please do not use extremely hot water in washing your vagina. It's either you're using a lukewarm water or a room temperature water in washing your vagina. And it's also important to know that, see, a lot of women make this mistake. Please don't clean your vagina maybe from, let's use this as an example. Don't clean your vagina maybe when you go to the toilet. Don't clean your bum bum like from the back like this to the front. Please, that's very wrong. Don't clean from the back to the front. I'm using this as an illustration so you understand. Please, to avoid this yeast infection, it's important to know that you clean your vagina from the front to the back. See, from the front to the back. Clean the vagina from the front to the back. Because when you clean your vagina from the back to the front, you are introducing feces, you are introducing bacteria, you are introducing all kinds of bacteria from the gut down to your vagina, increasing your chances of having not only yeast infection, you can also introduce other types of infection to your vagina. Now, it's also important to know that you as an individual now, you shouldn't wear damp clothes. Please avoid wearing damp clothes. Don't even put on a pants that is wet. Put on, all your clothes should be properly dried and if possibly ironed or sun dried. Yes, and also just make sure that you are always keeping your vagina dry. When you ease yourself, take a good tissue or water and wipe your vagina and pat dry it. Always keep your vagina clean. In that way, you are going to be preventing your yeast infection. You are going to save yourself this whole uncomfortableness that comes from itchiness of the vagina and everything that comes with it. So I hope that you understand our today's topic, and I hope with my illustration you were able to get all what I'm talking about. I noticed that in my last video when I talk about how to calculate your ovulation period, I saw that a lot of persons asked questions. So let me know on which of the topic you want us to talk more about. And please don't forget to click on the subscribe button. Don't forget to turn on your notification for more interesting episodes coming up. And thank you for staying to the end of this video. Thank you.